Ebola. You probably remember that name. It really exploded into our lives back in 2014, when this massive outbreak in West Africa was suddenly all over the news. And it brought with it a ton of fear, a lot of debate, and frankly, a whole lot of confusion.
But that initial concern, it kind of morphed into something else pretty quickly. One of the sources we looked at calls it an excessive anxiety bordering on panic, and that just hits the nail on the head. And a lot of that was fueled by media coverage that, let's be honest, focused on the absolute worst-case scenarios and all this misinformation that just spread like wildfire.
So that's what we're going to do here. We're going to try to cut through all that noise. We're setting the panic aside to look at the actual science, the real history, to get a handle on what Ebola is and what it isn't.
All right, so let's just dive right in and tackle those fears head on. Because a lot of what we think we know about Ebola, well, it doesn't really come from science labs. It comes from Hollywood.
You can really trace a lot of this back to two big things that came out in the 90s. First, you've got the book The Hot Zone. I mean, it reads like a thriller, but the science and the history in it are actually really solid. But then you have the movie Outbreak with Dustin Hoffman. And it famously has this plot where the virus mutates and becomes airborne. Now, that's something that's, well, scientifically pretty much impossible. But wow, did that idea stick in people's minds? It fueled so much of the fear.
Okay, so this gets us to our first big myth, the idea that the fatality rate is always 90%. But the reality is that number is not set in stone. It actually varies like crazy. We're talking anywhere from 30% all the way up to 90%. It really depends on the specific strain of the virus, and, this is the big one, the quality of medical care a person gets. If you had modern, ICU-level care, that number would almost for sure be way, way low.
And here's something else that might actually surprise you. Not every Ebola patient even gets a fever. Yeah, during that 2014 epidemic, about 10% of the confirmed cases never spiked a temperature. That's a huge deal, right? Because it means that just checking for fevers at the airport, well, it isn't a perfect system. It's going to miss people.
And, of course, there's the big one, the most dramatic myth of all, that terrifying cinematic image of patients bleeding from everywhere. Look, severe hemorrhaging can definitely happen, but it's not actually a common symptom. The vast majority of patients don't experience that at all. The reality, again, is just way less like a movie scene than we've been led to believe.
All right, so now that we've busted a few of those common myths, let's dig into the actual science. What exactly is this virus?
So Ebola belongs to this family of viruses called Filoviridae. They get that name from the Latin word for thread, basically because under a microscope, they look like these long, stringy little filaments. It first popped up in humans way back in 1976. But where does it hang out between these outbreaks? All the evidence we have seems to point to one place: bats. They're what's known as the natural reservoir.
And get this, Ebola isn't just one thing. There are actually 5 different species. Now, 2 of them, Sudan and Zaire, are the ones responsible for most of the big outbreaks in humans. But then you get these really interesting oddballs, like the restin species. It was found in lab monkeys in Virginia, of all places, but it doesn't actually make humans sick. And its origins trace back to the Philippines. It's still a total scientific mystery. How wild is that?
Okay, so to really understand just how massive and unprecedented the 2014 crisis was, we've got to go back. We have to look at the nearly 4 decades of history that led up to it.
The virus first really announced itself in 1976, with 2 outbreaks happening at the very same time in Sudan and Zaire. After another little flare-up in '79, things went quiet. I mean, really quiet. For 15 years, there were no recorded cases at all. Then, starting in the mid-90s, it began to pop up again in these smaller, scattered outbreaks across Central Africa. But here's the key thing to remember. For almost 40 years, every single Ebola outbreak was relatively small and, most importantly, it was contained.
But, history isn't just about dates and timelines. It's about people. The very first known case, what scientists call the index case, was a man who worked in a cotton factory in Sudan. He got sick with a fever, a headache, and bloody diarrhea. A week later, he was dead. And from there, the virus started spreading among his coworkers.
And you have to imagine, the conditions for the people on the front lines, they were just beyond difficult. We're talking about patients being treated on rusty old beds in open-air wards. These healthcare workers were facing a brand new, terrifying disease with almost zero resources. And, tragically, a huge part of the problem became infections spreading among the staff themselves.
Then, in December of 2013, the story of Ebola changed completely. Forever. It all started with a 2-year-old boy in a tiny village in Guinea. So why was this such a game changer? Well, because Ebola had never been seen in West Africa before.
The local doctors, the communities, they had zero experience with it. So the disease wasn't recognized for what it was, and that delay, that critical head start, allowed it to just explode across the borders into Sierra Leone and Liberia.
Just to give you some perspective on this, let's look at the numbers. Before 2014, the single largest Ebola outbreak in all of history was in Uganda, back in 2000. That involved about 400 cases, and at the time, that was considered a massive public health catastrophe. Okay, now watch what happens when we add the 2014 epidemic to that same chart. The scale just completely breaks. The 2014 epidemic didn't just break the record, it shattered it. It was bigger than all of the previous outbreaks in history combined.
By October of 2014, the official number was hovering around 10,000 cases. But here's the part that's honestly just terrifying. Everybody on the ground knew that number was a huge undercount. The real number of people infected was probably double that, maybe even more.
So you get to that terrifying point in late 2014, and the big question is, where does it go from here? Epidemiologists were just scrambling, trying to model what the future of this disaster could look like.
And basically, the model showed two very different futures. The best-case scenario was based on a huge, perfectly coordinated public health response that could, hopefully, get things under control. But the worst-case scenario, if that response failed, was frankly apocalyptic. They were projecting 200,000 cases by the end of the year, with that infection curve still pointing straight up.
And this incredible range of possibilities, from containment to catastrophe, led to this huge, terrifying question. Was the world watching an event that could literally reshape a continent in the same way the AIDS epidemic had? The stakes at that moment just could not have been higher.